Hello everyone, this is Dr. Davis and I'd like to speak to you about the physical consequences of smartphone use and specifically texting. And so just take a moment when you're outside the house, whether it's at a shopping mall or waiting in line or some event, or just people standing on the street. And you'll notice that the majority have their heads down, eyes locked on a smartphone. They appear to be oblivious to the outside world, with their elbows flexed, necks bent, friends ignored. Really, this is an ergonomic postural disaster that's putting a stranglehold on the spines and nervous systems across the entire planet. The numbers are truly staggering. With 7.3 billion cell phones in the world and 1.82 trillion text messages, and that was only 2010, I think it's easy to say that Houston, we've got a problem. The texting position is a disturbing combination of maximal neck flexion and anterior arm and chest flexion. In other words, texting requires that you place yourself in a position more akin to an 85-year-old shut-in rather than the usual demographic of cell phone users. This doesn't go without major repercussions. In fact, 1,200 people last year wound up in emergency rooms from distractedly walking into signposts and other objects while texting on the phone. There's even a report in China of a man who spent so many hours texting his girlfriend in the dark that he suffered a detached retina. I'd like to bring up a study by Kay Hansarai, the chief of spine surgery at New York Spine Surgery and Rehab Medicine. And it was shown that the texting posture can add up to 60 pounds of pressure on the upper cervical spine, depending on the degree of neck flexion. This is a lot like carrying a large dog like a Labradoodle on your back all day long. When you combine this extreme load on the upper spine and neck with the reality that people can spend 2 to 4 hours per day with this accumulative trauma, it's not a surprise that doctors are seeing more and more texters for back and neck pain. But of course, this has to include more people than this, the people who read books on the phone web surfers, and phone gamers. In 1 year, this 1,000 to 1,400 hours of neck stress will begin the process of inflammation, ligament elongation, postural deviation, decreased lung expansion, and ultimately spinal degeneration. Unfortunately, high schoolers have a tendency to have much more texting time than adults. So the 1,000 hours for the average adult goes up to 5,000 hours with high schoolers. You can see by the severely tilted neck in these pictures that the strain is primarily focused on the junction of the neck and the upper back. This places all 60 pounds of force in a small area, straining and shearing the joint structures. Invariably, pain and injury result. Unfortunately, most people don't know that there are neurological mechanisms that are triggered when the neck is flexed like this, such as upper trunk contraction, which then causes more flexion, and lower back inhibition, which then causes weakness and instability of the lower back. And children's necks are even more vulnerable to damage. Their head to body ratio is much larger, and their muscular strength is much less, increasing the stress and injury. In addition, the bodies of children are still growing, and so this trauma will be developed into their necks permanently. It's common to see x-rays of a 30-year-old, for instance, that has the spurring and degeneration of a 50-year-old without any history of accidents or trauma. Their only misfortune was being raised in the information age. So as far as I can see it, you've got two options. One is prevention, and the other one, of course, is treatment. Prevention first. This really has to do with proper ergonomics. First, try pulling your elbow in, the one that's holding the phone. This will raise the height of the phone several inches and take a load off your neck. Next, you'll notice that your eyes are pointing down, but you have to keep your head up in neutral position. The ears should be positioned over the shoulders and the shoulders over the hips. That way, you're only holding your head vertically, which weighs about 10 to 12 pounds. When the eye angle is declined, they also converge, making it easier to focus on the object. But the longer they converge, the more eye strain ensues. Next, try to do a series of postural isometric exercises that neutralize the texting effect, like tilting the head back and looking up, or using an app on your iPhone called Yogis during the day. And last, Enjoy your real as opposed to virtual life. Just put the cell phone down sometimes. The next option we've got here is treatment. Unfortunately, once the damage has begun, prevention isn't always effective. That's when you need some structured, focused, and intelligent plans to overcome your past transgressions and accumulated injuries from other kinds of mishaps. This must incorporate a relining of the bones of the neck so that the balance returns. Chiropractic is the only real choice here, and so it's the best option. Along with this, we use techniques that reform and retrain your natural neck curve that allows the head to be placed on top of the neck instead of forward. And lastly, the soft tissue mobilization we employ stimulates both the healing of injured ligaments and nerves that support and inform the spine of proper posture. So please let us know if you'd like a complimentary consult and exam by giving us a call to see if you're a candidate for care. Hope to see you soon. Bye-bye.